You know that feeling when you walk into a doctor's office? You feel absolutely terrible. Maybe you're dizzy, your heart is racing, you feel like you're about to collapse. But then the nurse wraps that cuff around your arm, pumps it up, and says, 120/80. Perfect. You're doing great.
And you just want to scream.
Exactly. You want to scream because you know that number is a lie. Or at least it's not the whole truth. It feels like gaslighting, but with medical equipment.
It is incredibly validating to hear that because for people with adrenal insufficiency or AI, that scenario isn't just annoying, it is a physiological trap. We are diving deep today into an article from My Adrenal Life that tackles this exact phenomenon. It's about why your blood pressure and heart rate numbers can be absolutely all over the place when you have AI, and why that perfect reading in the clinic might actually be a sign that your body is struggling, not that it's thriving.
This really caught my attention because we usually think of blood pressure as this static thing. You have high blood pressure, you have low blood pressure, but this article suggests that for people with Addison's disease or secondary adrenal insufficiency, the numbers are more like a roller coaster than a flat line.
Right, and to understand why, we have to completely rethink what cortisol actually does. Most people just know it as the stress hormone. You get stressed, cortisol goes up. End of story. But if you look at the physiology and resources like the National Institute of Diabetes and Digestive and Kidney Diseases are very clear on this, cortisol is actually a maintenance hormone. It is the steady hand on the steering wheel of your cardiovascular system.
So it's not just the gas pedal for stress?
Not at all. Think of cortisol as a permission slip. It gives your blood vessels permission to squeeze and relax properly. In medical terms, we talk about vascular tone. Your blood vessels are lined with tiny muscles. For those muscles to respond to the signals to tighten up, which raises your blood pressure and keeps blood flowing to your brain against gravity, they need cortisol to be present.
So if you don't have that cortisol, the permission slip is missing?
Exactly. Without cortisol, your blood vessels become kind of floppy. They don't have that responsiveness. So imagine you stand up. Gravity immediately pulls your blood down into your legs. In a healthy person, cortisol helps the vessels constrict instantly to push that blood back up to your head. In someone with adrenal insufficiency, that signal gets lost or is too weak. The blood stays down, your pressure drops, and you get dizzy.
That explains the low blood pressure, but the article talks about numbers being all over the place, highs, lows, rapid spikes. If the vessels are floppy, wouldn't the pressure just stay low all the time?
That is where the chaos enters the system. The body has a backup plan. If cortisol isn't there to maintain pressure smoothly, the nervous system panics. It realizes, hey, blood pressure is crashing, we're going to pass out. So it dumps a different set of chemicals, catecholamines. This is your adrenaline and noradrenaline.
The fight or flight chemicals.
Precisely. And unlike cortisol, which is a smooth, long-acting regulator, adrenaline is a hammer. It smashes the heart rate up. It forces a rapid, aggressive constriction of the vessels. So you go from sitting on the couch with low pressure to standing up and having your heart rate spike by 30 or 40 beats per minute just to keep you conscious.
That sounds exhausting.
It is profoundly exhausting. That's why patients describe feeling wired but tired. Their body is running on emergency generator power, adrenaline, because the main power grid, cortisol, is down. So when you see those numbers fluctuating wildly, what you're seeing is the war between a system that wants to collapse and a nervous system that is frantically trying to prop it up.
And that connects to something the article mentioned about vascular tone. I wanted to dig into that because it sounds technical, but the way you described it as floppy vessels makes sense. It reminds me of a garden hose. If the hose is firm, the water shoots out strong. If the hose is soft and expanding, the water just trickles.
That is a perfect analogy, and cortisol is the material that makes the hose firm. Now, there is another layer to this depending on what type of adrenal insufficiency you have. The article distinguishes between primary AI, or Addison's disease, and secondary AI. The blood pressure mechanics are slightly different for each.
Right. Primary is when the adrenal glands themselves are damaged, usually by the immune system, so they can't make hormones. Secondary is when the pituitary gland in the brain isn't sending the signal to make cortisol. But why does that change the blood pressure situation?
It comes down to a hormone called aldosterone. The adrenal glands produce both cortisol and aldosterone. In primary AI, Addison's, the damage to the gland usually destroys the ability to make both. Aldosterone is responsible for holding on to salt and water. If you don't have it, you literally pee out your blood volume. You become dehydrated and hypovolemic.
So in primary AI, you have the floppy hose problem from low cortisol, plus you have less water running through the hose because of low aldosterone.
Double whammy. That is why people with Addison's are so prone to severe orthostatic hypotension, that drop when standing, and why they crave salt so intensely. Their bodies are desperate to build up blood volume.
Okay, so what about secondary AI? The article says they usually keep their aldosterone function?
Yes, because aldosterone is controlled by the kidneys, not the pituitary. So in secondary AI, the salt and water balance might be okay, but, and this is a big but, they still lack cortisol, so they still have the floppy hose issue. They still have the vascular tone problem. They might not be as dehydrated, but their vessels still don't constrict properly in response to stress or standing.
So they aren't off the hook.
Not at all. And the article makes a crucial point that even in secondary AI, the signaling to the stress response is disrupted. When we look at literature from places like the Mayo Clinic or the Endocrine Society, they confirm that cortisol deficiency alone is enough to cause instability. You don't need to lose aldosterone to have those wild heart rate swings.
I want to circle back to that opening image, the doctor's office. The article has this section about why talking or medical appointments raise the numbers. It calls it a performance.
Yes, this is the white coat effect, but for AI patients, it's almost inverted. Usually, we think of white coat hypertension as someone who is healthy but gets nervous, so their BP spikes to unsafe levels. For an AI patient, their baseline at home might be 90/60, very low. They feel sluggish. They drive to the doctor, which takes focus. They walk in, which takes physical exertion. They have to answer questions, recall their medical history, advocate for themselves. That is a massive stressor.
So the stress response kicks in.
Right. The adrenaline dumps, the heart rate climbs, the blood vessels clamp down as hard as they can. By the time the cuff goes on, their pressure might read 120/80. Normal. But that normal is actually a stress spike for them. It is their maximum capacity.
That is fascinating. So the doctor sees 120/80 and thinks healthy baseline, but the patient is actually redlining their engine just to sit in the chair.
Exactly. The doctor is looking at a snapshot of a person running a sprint, but the doctor thinks the person is resting. If that patient went home and sat on the couch for 20 minutes, their pressure might crash back down to 85/55. The doctor never sees that crash, so they assume the medication dose is fine or even that the patient is anxious.
And that leads to the "it's all in your head" diagnosis.
It's the most frustrating thing patients face. The article emphasizes that this variability is physiologic, not psychologic. It's not anxiety in the psychiatric sense. It is a chemical compensation for a missing hormone. When you lack the buffer of cortisol, every demand, physical, cognitive, emotional, hits your system raw.
It's like driving a car with no suspension. You feel every single pebble on the road.
Perfect. And a medical appointment is a very bumpy road.
So if the snapshot in the clinic is unreliable, what is the solution? The article talks heavily about tracking.
Data is your best defense. The article suggests longitudinal tracking, which just means tracking over time. You need to capture the movie, not just the snapshot. This involves checking your blood pressure and heart rate in different contexts. Check it first thing in the morning before meds. Check it when you feel that crash or dizziness. Check it after a stressful phone call.
And you should probably note what you were doing, right? Because a 110/70 while running for the bus is different than a 110/70 while sleeping.
Context is everything. The article lists specific things to track: posture, activity, and symptoms. For example, if you track your numbers and show your doctor, look, every day at 4 p.m., my blood pressure drops to 90/60 and I get brain fog, that is actionable data. It suggests your morning dose of medication has worn off.
A single perfect reading at 10 a.m. in the clinic tells them nothing about that 4 p.m. crash.
It seems like this also ties into the concept of heart rate variability, or HRV. The article touches on how the nervous system downregulates when you finally sit down.
Yes, HRV is a great measure of autonomic health. In a healthy system with cortisol, transitions are smooth. You stand up, heart rate goes up a little, then settles. You sit down, it drops gently. In AI, because of that adrenaline dominance we talked about, the heart rate tends to be jerky. It spikes high and stays high until the demand completely disappears, then it plummets. It lacks that nuanced, flexible adjustment. If you wear a smartwatch, you might see your stress scores are constantly high, even when you're not doing much, because your heart is beating with the regularity of a metronome, which is actually a sign of stress, rather than the healthy, variable rhythm of a relaxed system.
Wait, a regular metronome beat is a sign of stress? I always thought a steady heartbeat was good.
It's counterintuitive, right? But a healthy heart is responsive. It speeds up a little when you inhale, slows down when you exhale. That variability shows that your parasympathetic nervous system, the rest and digest system, is active and listening. When you are running on pure adrenaline because you lack cortisol, that variability disappears. The heart is just being hammered to beat fast and hard. So low variability often correlates with that wired feeling AI patients describe.
That really flushes out the why behind the symptoms. It's not just low cortisol. It's the domino effect of low cortisol leading to high adrenaline, leading to vascular instability. I want to ask about the practical side of this. If someone is tracking these numbers and sees this roller coaster, what does that actually mean for their treatment? Does it mean they need more steroids?
That is the million-dollar question, and obviously everyone needs to consult their endocrinologist, but generally, this kind of instability suggests a coverage gap. Cortisol replacement therapy, like hydrocortisone, has a very short half-life. It stays in the system for maybe 4 to 6 hours. If you take a pill at 8 a.m., by 2 p.m., you might be running on fumes.
So that afternoon crash isn't just a sugar crash.
For an AI patient, it's likely a cortisol crash. The tracking data might show that their blood pressure starts to get erratic right before their next dose is due. This helps the doctor decide if they need to split their doses differently, maybe taking smaller amounts more frequently to smooth out the curve, rather than one big peak and a deep valley.
And for the primary AI folks, the Addison's patients, the tracking might reveal something about their aldosterone replacement, right?
Absolutely. If their blood pressure drops significantly every time they stand up, orthostatic hypotension, despite their cortisol levels being decent, it points a finger at the mineralocorticoid, the fludrocortisone. They might need a higher dose to help retain more salt and volume, or they might simply need to consume more salt and water. The data helps distinguish, is this a cortisol problem, vascular tone, or an aldosterone problem, blood volume?
It empowers the patient to come to the doctor not with a complaint, but with a hypothesis based on evidence.
And that changes the dynamic of the appointment entirely. Instead of, I feel bad, which is subjective, you say, here is a graph showing my systolic pressure drops 20 points every day at 3 p.m. That is a physiological fact that requires a medical solution. It cuts through it's anxiety dismissal.
I think that's such a critical takeaway. We often feel like we have to perform wellness for our doctors, or we feel like failures when our bodies don't cooperate. The article mentions this explicitly. You are not failing, you are not imagining it.
That is the emotional core of this piece. Chronic illness can feel like a personal failing, especially when the mechanism is invisible. But when you understand the mechanics, the receptors, the hormones, the blood volume, you realize it's just physics and chemistry. It's a broken part in the machine. It's not a character flaw. Your numbers are all over the place because the regulator is missing. That is it.
It's interesting how this article also mentions the cognitive load of talking. I hadn't thought about that as a physical stressor. It lists cognitive focus, breath control, emotional engagement as things that triggered the stress response.
We underestimate the caloric and hormonal cost of conversation. Talking requires complex coordination. It changes your breathing pattern, which changes the pressure in your chest cavity, which affects blood return to the heart. For a healthy person, cortisol manages these micro changes instantly. For someone with AI, an intense conversation can literally drain their battery. This is why many patients report crashing after social events or long meetings. It's not just being an introvert, it's that their cardiovascular system was running a marathon to keep up with the conversation.
So if you have AI and you notice your heart pounding while you're just sitting there talking to a friend, that's real.
It is real. It is your body dumping adrenaline to compensate for the demand of the interaction. And recognizing that can help you manage your energy. Maybe you need to sit down, put your feet up, or take a hydration break during long conversations. It's about learning to operate the manual transmission of your body because the automatic transmission, cortisol, is broken.
That analogy of the manual transmission is perfect. You have to manually shift gears that everyone else takes for granted.
And sometimes you grind the gears. That's the fluctuations. That's the numbers bouncing around. It happens. It doesn't mean you're doing a bad job driving. It just means it's a hard car to drive.
We've covered the mechanism of cortisol and vascular tone, the adrenaline compensation, the difference between primary and secondary AI regarding aldosterone, and the importance of tracking. Is there anything else about the long-term impact of this variability?
I think it's worth noting the long-term wear and tear. Relying on adrenaline for stability isn't a sustainable long-term strategy. It places strain on the heart and the blood vessels. That's another reason why getting the cortisol dosing right is so important. It's not just about feeling better today, it's about protecting your cardiovascular system for the future. You want to get back to using the smooth regulator, not the emergency hammer.
This has been a massive eye-opener, I think, for anyone listening who has dealt with these mysterious fluctuations or who has a family member with AI. This reframes the whole experience. It's not random chaos. It's a predictable response to a missing part.
Predictable and manageable. That is the hope here. Once you see the pattern, you can manage it.
If you found this deep dive helpful, think about who else in your life might need to understand this mechanism. Maybe even your own doctor.